Each year, colon cancer claims more than 53,000 lives in this country. In fact, colorectal cancer is the third leading cause of cancer-related deaths in the United States. The diagnosis doesn't need to be a death sentence, but early detection is key. March is Colorectal Cancer Awareness Month, and with us this morning to talk about screening is Dr. Andrew Siegel, a primary care physician at Toro. Now, first of all, when we talk about colorectal cancer, we're talking colon and rectal.
That's correct,
okay.
Yes.
And what are some of the symptoms? I know there's a lot, so let's kind of go through some of those and we'll have a full screen while you talk.
Okay, so symptoms can range from a variety of different things depending on the stage of cancer. So some people can have just a symptomatic anemia where they get a little short of breath and they feel a little pale, colder more often, or some people with more advanced cancer can have bloody diarrhea, or they can have constipation, they can have very thin, stringy stools. Also, some people can have bloating. Sometimes people feel like they can't fully evacuate their bowels.
Oh, sure.
Yeah, so.
Gosh. And in some of those symptoms you wouldn't even think right off the bat.
Correct, yeah.
Colon cancer.
Yeah, so each person needs to talk to their doctor about their symptoms and also about their risk factors.
Some of these numbers I saw are just incredible. In the United States, 1 in 21 men will be diagnosed.
Correct, yep.
And 1 in 23 women with a type of colorectal cancer.
Correct.
So who's really at risk though? What age groups? What?
So that's a good question. So we normally start screening at age 50 in just general screening. However, each person should talk to their doctor about their individual risks. So people who have cancers like colon cancer in the family, also people with Crohn's disease, ulcerative colitis, people also who actually eat a lot of high fatty foods, red meats, those people are at increased risk of actually having colorectal cancer.
I love how you tailor it to an individual basis. Now, we all know you're supposed to get a colonoscopy. You just said at the age of 50 every 10 years, but there's some other options. Tell us more about that.
So for those people who are a little bit shy about the colonoscopy, there is something called a Cologuard, which you can do once every 3 years. The company will send you a box and they have instructions on how to use it.
So you do it in the comforts of your home?
Own home, correct.
Okay,
yes.
okay.
And then there's something that we also have, these stool cards. And what we do is we send you home with stool cards, and you, when you're at home.
So this is a look? Okay.
Yeah, that's what they look like.
Oh, okay.
You do like 2 or 3 of them, and then you have a bowel movement. You place some of the sample on the cards, and you either send them back to the lab, or you bring them back into the lab yourself.
Oh.
And it's a once-a-year screening that you do.
And I know you wanted to mention that you don't recommend either of those two. They're great options, and if you get a positive test, you need to come in immediately for a colonoscopy.
Yeah.
But why do you say maybe?
So I would prefer the colonoscopy for people because, you have a 24-hour period where you have to drink the preparation. However, it's very simple, it's very painless. You go in there, and if the physician, the gastroenterologist, goes in and sees a polyp, they can take it out right away, and they can see what it looks like and see what your risks are. And it's a very powerful screening tool, because if you do the Cologuard or do the Hemocold and it becomes positive, then you need to go back to the colonoscopy.
So these are great options if you're really scared of a colonoscopy, but you still want people to kind of come in.
Yeah, correct. Each individual person needs to be screened on an individual basis.
Sure.
Yeah.
Well, we know you're a busy man. Thank you so much for your time this morning, Dr. Siegel. And for more information and to take an online test to find out your colorectal cancer risk, visit our website, wwltv.com, for a link to Toro's website, toro.com. You can also call 897-7777 with any questions or schedule an appointment with a Toro doctor.